Welcome to my podcast. Today I'm going to talk about another common case I used to see back home. So after you double check, after you introduce yourself basically and double check the patient name and date of birth, you'll ask the patient, how can I help you? So the patient might be a young male or a young female, teenage. They might be feeling embarrassed, shy. They might say, "Oh, doctor, I'm having this smelly feet in my foot, and it's really annoying, very disturbing for me. People around me notice and ask me, oh, what's this horrible smell?" So you'll ask the patient, can you tell me more about it? Did you notice this recently? Did you have it a long time ago? What do you do? Any work you do and makes this more exaggerated? Does it come in a specific time? Um, so you will ask about all the question. And also you will ask if there is anything between the toes and ask if the patient have any medical history, like for instance diabetes, or if there is any family history of same thing. Maybe it's excessive sweating, and if the patient doing too much exercise, too much walking. Ask about the weather condition, if it's a hot one, if he's living in a hot place, for instance, or if he's working in a hot place, for instance, because the UK in the summertime can be very hot, but in the wintertime can be very cold. So ask about the condition where the patient is living. Ask about them if they are standing all day, and also check their body mass index if they are overweight. So that's another issue. Teenage or in pregnancy, there's different changes in the body, which could be hormonal. And also ask if there is if they notice any excessive sweating, for instance, all over the body, or only in the feet, or in the palm, or in the armpits. So a certain patient, they might have this sort of sweating only when they are very tense or stressed, or anything affecting them. So you can ask all those questions in order just to rule out what might be the cause, and also ask the patient taking any medication in the long run, for instance, just to see, and also ask the patient what's their shoe condition and what they wear, if they wear any socks, what sort of socks do they wear, and the shoe, if it's breathable or not, if it's very tight, all of that, just to have an idea what might be going on. So you need to rule out, for instance, fungal infection. You need to rule out bacteria. There is another condition whereby the patient might notice that excessive sweating in their feet, and they have like small pits in their feet. That's a condition. That's a skin condition, which is affecting some patients. In that condition, you need to tell them this is a skin condition which happens sometimes, and certain people you will tell them, I need to examine and have a quick look what's going on, and then I will agree with you about the management plan. And as I say early on, if they have, the patient have any thought what might be the reason. So emphasize about cleaning and keeping the feet dry most of the time, because moist or any wetness in that area could driven fungal infection, bacterial infection, and which cause maceration, cause slits, cause pain. All of that will, of course, exaggerate the condition of the smell. Also, ask the patient that they need to keep washing the feet at least once a day, using in certain situations antibacterial soap to get rid of the smell. And if there is any fungal infection, they need to treat it. They can use also foot powder and antiperspirant, like the one used in the armpit. So there are specific ones. Emphasize about the importance of changing the socks and using the cotton one, and avoid the polyester. And also for the shoes, to choose the comfortable one and breathable one. And if the shoes, because of sometimes too much rain here in the UK, so basically the shoe might be wet, and maybe the patient they keep walking with that, which will of course increase the condition of wetness of the feet, and which will lead to fungal infection and will cause the horrible and annoying smell. Also ask the patient, they need to change their socks frequently and not to wear it in row, and avoid any tight fitted shoes, or the synthetic one, and also avoid walking barefoot when it's wet, in certain areas where there is gyms or showers or swimming pool. And then you will agree, of course, about certain medication if the condition needed. Like, for instance, a fungal infection, you'll give antifungal infection like Mycoter, Lamizil cream. If it's bacterial, you will give, of course, antibacterial creams or powder, and also the antibacterial soaps to be used. Also, there is certain perspiration deodorant can be used for the feet to minimize the smell. And also, if there is any overweight after checking the BMI, you could emphasize about trying to lose some weight. And by that, I should have covered what's the main issue with the smelly feet, and if there is any need, for instance, for a foot specialist for the foot care, or for wearing special shoe, you could refer them to that. Thank you.